Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Ana Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome back to Physician Heal Thyself, the podcast. I'm your host, Dr. Ana Lara. I'm a naturopathic medical doctor, and I'm based out here in Arizona, and I create these videos for educational purposes. So please like and share and subscribe to the channel and share this with someone who you think it might really change their life. So this episode is going to be dedicated to National Kidney Month. And we're going to talk about how the ways that you can protect your kidneys and ways that you can potentially reverse kidney disease in a natural way. So like I said, this episode is for educational purposes only. I don't know your medical history, so you want to follow it with your doctor on any recommendations so they can help treat you. I want to start off with some statistics. So, kidney health is something that's really important for me. It's personal. My father had kidney disease that ended up in dialysis, and having experienced seeing him go through the process of dialysis, I was lucky enough to go to the back and see how it's all done, and the technicians and the doctors showed me how the machines work. And, we have different ways that people can do dialysis now, but I want to really start off by telling you, you don't want to get to the point that you're having to do dialysis. Hemodialysis is a process. When it comes to the point that your kidneys are not functioning, get the chances of you getting on getting a kidney transplant. It's a 5-year wait, and so you have to do something in the meantime. Which the next option would be dialysis, and it is something that is extends a person's life, right? So it's a good option that's available. But you're having to do this 3 times a week, and it's typically 3 to 4 hours each day. So I know I often get patients who say, how inconvenient it is to cook or work out, or that they don't have the time to work out and cook and prepare meals. But I'm telling you, you might want to start making the time to make that happen. Because you either start investing that time right now, today, and moving on forward every day of your life, or you will pay for the price on the back end, and it will come with a hefty, interest added to that. And it just doesn't affect you, but it affects those that you love, having seen you go through the process of dialysis. So I'm going to share some stories at the end, but I want to start off by sharing some statistics. And these statistics are from the CDC from 2003, and I'll provide links to, the citations to this. More than 1 in 7 U.S. adults, so that makes about 35.5 million people, okay? So 14% of the population is estimated to have chronic kidney disease. And we're going to talk about the stages of kidney disease and what that means. So as many as 9 in 10 adults with chronic kidney disease do not know they have it. So 9 out of 10 don't know they have kidney disease. So you might be one of those people walking around thinking your kidneys are fine because there's no symptoms, there's no signs, and you're fine. About 1 in 3 adults with severe kidney disease, so this is the end stages, right, do not know they have it. So ignorance is not bliss, okay? You want to be informed what is your kidney function. And when I review labs with my patients, one of the things that I ensure is that they understand what they're looking at in their labs so they know where to look for when it comes to their kidney function. So some of the risk factors that would predispose someone to having a higher risk of developing kidney disease is people with diabetes, high blood pressure. These are very common causes of kidney disease. And the reason is because the vascularity that goes to the kidneys is so small and so thin. These are fine little veins and arteries, and so if circulation of the blood is a problem, as it is in hypertension or high blood pressure and diabetes, right? It's going to reduce the amount of blood flow that the kidney is receiving. If not enough blood flow is going to it, this organ starts to die slowly. That's what it is. Chronic kidney disease is the organ is shutting down. It's dying slowly. It's not working. People with heart disease, obesity, and a family history of kidney failure are high risk factors. Also, some of the ethnicities that are highest at risk are African Americans, Hispanic, Native American, Asian, Pacific Islander are the highest at risk of developing kidney disease. Now, that doesn't mean that everyone else is not at risk for it. I think a lot of Americans have a higher risk because of the amount of toxic exposures that we have in our diet and so forth. So people that smoke also have a higher risk of developing kidney disease. Now, so this isn't talked about a lot. Oftentimes we know that it can contribute to lung cancer and other cancers, esophageal cancers. But the reason that smoking and even secondhand smoking that you're receiving can put you at risk is there's a toxic ingredient in cigarettes called cadmium. And cadmium is found in cigarettes and cigarette smoke. So when it's inhaled, this causes an accumulation in the blood and it causes damage to the kidney. So we're going to talk about what is the function of the kidney, because what happens is that the body's trying to eliminate this toxin, but it can't. It keeps being recycled to stay back in the kidney. And over time, this causes damage to the nephrons of the kidney. So some of the signs that you can kind of start taking into account, you can just start listening and thinking, do I have any of these? Sometimes the signs of chronic kidney disease are weakness and fatigue, which a lot of medical conditions have that. Swelling of the hands and feet, tingling in the hands and feet also. And this is due to poor circulation. But here's a classic thing you can look at. If you look at the lower part of your legs, and you find that there's edema, so like there's swelling if you push on there, if you put your thumb on that area and it leaves an imprint, you have edema, and that could be either heart related or kidney related. Also, if you find that lower part of the legs, there's like discoloration, like a darkening of the skin, that is also indicative of poor circulation, and it could be related to kidney disease. The other thing is persistent puffing under the eyes. And it's not just a little puffing like, oh, I didn't get to sleep enough, so my eyes are puffy. No, it's persistent, like a little pouch in there. That's how you can tell that someone is probably having some issues with their kidneys. Our eyes can tell a lot about our health. So you want to take a look at that. If the person's urinating foamy and dark urine, that's a sign that, your kidneys are not filtering well. So you definitely want to get that checked out. Nausea, vomiting, loss of appetite. If you're having sleep problems, especially because you're getting up a lot to urinate. Now, that could be contributing from something else, right? So this is an accumulation of symptoms that we're talking about here. High blood pressure, shortness of breath, any chest pain, blood in your urine, frequent urination, are all signs that of possibly that you may be experiencing chronic kidney disease. Now, so what are the complications of kidney disease is oftentimes the kidney disease does worsen over time, especially if you don't do anything about it. And so it can lead to other health problems. It could eventually, unfortunately, lead to a stroke or a heart attack. So, and obviously it leads to being on dialysis for a lifetime, unless you get on the kidney transplant list. So treatments for kidney failure is, like I said, is dialysis or a kidney transplant. And the fact is that the organ most frequently on the wait list, for a transplant is the kidney. 86% of patients that are in need of a kidney are waiting for approximately 5 years to get a kidney transplant. And so there are certain requirements, right, that you need to meet in order to get on that wait list. And if you're smoking or you have a history of smoking, there's a slim chance you're going to get on that list because they want to make sure that these organs are going to go to someone that they're going to have a higher likelihood of living through that, right? So after the statistics show that after 1 year of dialysis, the mortality rate is 15 to 20%. And I'm going to tell you why. Having been in and out of dialysis centers, I can see why. They never address the root cause. They never talk to patients about how to, properly eat. They do some renal diets that they go through, but some of those renal diets, as a physician, I would never tell someone with kidney disease to eat those foods because it's just not healthy. And so there's still not proper education and guidance to people who are on dialysis on how to preserve themselves even further. So unfortunately, after a year of dialysis, 15 to 20%, they don't make it. And there's a misconception that dialysis is done typically on older patients, and it's not. There's a lot of young people that I've seen in dialysis centers, 20-year-olds and 30-year-olds. So it's not a disease of aging folks anymore. And there are a lot of reasons that, can contribute to kidney failure. It's not just diabetes. There's autoimmune conditions. There's genetic situations that cause issues, cancers and so forth that, if someone has kidney cancer, they have to get rid of the kidney. And so they end up over time developing kidney disease. So after 5 years, the survival rate for people who receive transplants is about 80%. So some of the tests to evaluate, there's one very important test you should know, and you can look at when your doctors run your test. It's going to say eGFR. And this eGFR, it stands for estimated glomerular filtration rate. And this measures how well your kidneys are filtering metabolic waste. And so this test is part of a panel called a comprehensive metabolic panel. So you can look at your blood work and go look at the eGFR, and that's your kidney function. And so this is typically routinely done by doctors. So we're going to talk about the stages of kidney disease. So when you look at these numbers, the eGFR, stage 1, I always tell people you want to be 90 or higher. That means your kidney function is normal. If your kidney function is between 60 and 89, that's considered stage 2. And when I see people under 90, that's mild kidney damage, but we're still focusing on how can we improve that. And look, despite what anyone says, you can improve kidney function. I've seen it time after time. I've had patients where their kidney function was at 20 and 30, and we increased that to being above 90. So there are things that can be done to improve kidney function. Stage 3, there's 2 categories to stage 3. There's A and B. And stage 3A is going to be between 45 and 59, and that's a mild to moderate kidney damage. The eGFR for, the stage 3B, this is between 30 and 44. And this is really getting down there. And this is when, your doctor will, anything under 60, they'll start referring you to a nephrologist, which is a kidney specialist. And the nephrologist will start to monitor this for you and may prescribe some medications to regulate blood pressure or potassium and phosphorus levels, which we're going to talk about later. But this is a moderate to severe kidney disease damage. So in stage 3B, you're most likely going to be seeing a nephrologist to be evaluated and monitored. And stage 4, you're between 15 and 29, and this is severe kidney damage. It is in this stage that the nephrologist will start talking to you about dialysis. And that's a process, we're going to talk about that. And so stage 5, it's your eGFR is less than 15. And that's kidney failure. So you're not eliminating waste. It can accumulate, it can cause a heart attack or stroke. So this will require dialysis or a kidney transplant. And I already shared with you the statistics for kidney transplant. There's a wait list. So it is the number 1 organ that's on the wait list. So you're not going to get an organ transplant that's quick. So chances are you're going to be on dialysis until that happens. So I do want to talk about, when you're working with a nephrologist, and I'm telling you this from experience. I used to go with my father early on to the nephrologist and see what would he tell him. And I was kind of undercover. I was like a regular. I didn't share that I was a doctor. I just sat in on the visit and sometimes would ask questions. And in one visit, I asked him, hey, is it true that you told my dad it's okay for him to drink like Diet Coke, diet sodas? And he's like, yeah, it's okay. I said, really? The aspartame, which is in these diet sodas, has a huge impact on the kidney function. And I had two case studies, studies, and I provided them for him. I said, I brought these for you to take a look at. And I've been telling my dad to not drink any of the diet drinks. And so he said that you said it was okay. So he took him the next time, 3 months later, when he was back at the office, I went with him. And the nephrologist said, thank you for sharing those articles with me. I was not aware of that. I was blown away that as a naturopathic doctor, we're trained to know that. Why is a nephrologist not trained to understand the toxic chemicals in foods and drinks that cause issues to your kidneys? So what I noticed he was an amazing guy. He was very friendly, very open to conversation and hearing my points. He did end up finding out that I was a naturopathic doctor because he thought it was weird that I knew all these things, right? Eventually he would catch on. And we had a great, friendly, relationship. But, what I found was that oftentimes they're just monitoring to see when it's time to talk about, getting yourself prepared for dialysis, because it's a process. You can't just do it overnight. And that's what they're there to monitor when it's time. I'm going to say this, that, there's a lot of money that's made in dialysis centers. I mean, they're charging $5,000 or more for each treatment, and you're doing those 3 times a week for the rest of your life. And they're billing insurance. And I mean, that's just the treatment. It's not everything else that's included, right? And so, I mean, it is a big moneymaker, unfortunately. And so, they don't have any other ways and tools to educate people. They don't know what to tell people that they can reverse kidney disease. So when you are in that stage 4 where kidney function is between 15 and 30, they're going to start telling you, it's time to start considering your dialysis options. Here's the options. If you go to a dialysis center, they have to place a fistula, and that does require surgery. Usually it's placed in the arms. And so they will, surgically, it's like they're creating a super highway in the veins so that when they do the treatments, they're able to do them a lot faster. And so they connect to this to do the dialysis via that fistula. It is a surgery that they need to go in and do this modification of the veins, and they have to find a good vein, a good arm to do it. And so it takes about 6 weeks for it to heal, and then they'll test it to see if it's functioning, if it's flowing right, and if it is, then they can start to use that fistula to do dialysis. That arm cannot be used for nothing else. You can't have blood drawn on that arm. You can't have your blood pressure taken on that arm, because it will impact that fistula. And guys, it's a very funny sensation to touch someone's fistula. It's almost like a buzzing feeling they have all the time that they're feeling there, because they've changed the anatomical structure of the veins, for them to be able to use them at higher speeds to be able to filtrate your blood. The job of the kidneys is to filtrate all the toxins. It's an organ that helps eliminate toxins. And when that organ is not functioning, those toxins are going to stay in your body. So we want to make sure, remember, eGFR, the filtration rate, should be 90 and higher for optimal. Anything under that, you want to start looking at how to protect your kidneys. So we're going to move into the next segment on how do you protect your kidneys. What are some ways, what are some things that you can do to protect your kidneys? Now, you guys know, if you've listened to these podcasts on Physician Heal Thyself, you're going to know that diet is always going to be the main thing. There's nothing, fancy and sexy and modern that you can do that's ever going to replace the benefits of keeping a healthy, nutritious diet, right? So the top things you definitely want to reduce are sugar. Remember, if you have a lot of glucose, sugar in your blood, that is going to make your blood viscous, thicker, and the flow of blood is going to be more difficult. And the number one reason that people with diabetes will end up with kidney disease, also eye issue and circulation to your hands and feet, is because the vascularity to these areas are very, very small, very fine. And so the smaller the veins and arteries are, the harder it's going to get for that really thick, viscous blood, right, to get through and make it to these organs. And so that's why you'll see damage to people's eyes, right? You'll see damage to the kidney. And so you want to, cut back as much as processed sugars and even some of those high, glucose fruits as well. So you want to really add more vegetables and proteins are okay. You want to cut out all those artificial food colorings and flavors, MSGs, things like that. Things that I've talked about in previous episodes, pretty much. And anything with high fructose corn syrup is going to have an impact on kidney function as well as, like I said, if you're smoking, that's not going to help. So get more vegetables in there. One of the things that dietary wise, if your kidney function is under 60, the eGFR is under 60, you want to make sure that you're reducing foods with that are high in potassium and high in phosphorus. So the problem is, as the kidney doesn't function as optimal, it's very difficult for the body to process potassium and phosphorus. So oftentimes people will have higher levels of potassium and phosphorus, and the nephrologist, what they'll do is they'll throw a binder. They'll tell you to reduce the foods. They will say that. And they'll give you a handout of the top foods that have potassium and phosphorus. But they'll also throw in a binder, a pill that you'll take that'll bind excess phosphorus and potassium, especially potassium, to get it out of the body. So the next thing you want to do, if you have healthy kidneys, you want to make sure you're getting enough water intake. Kidneys love water. But here's the caveat. If you have chronic kidney disease, you cannot drink that much water. Your doctor's going to tell you, the nephrologist will tell you, what are the safe amounts of water for you to drink based on your kidney function. So people who are on dialysis, they can only consume 32 ounces of fluids a day. We live in Arizona here. That's nothing. And this is including soups. It's including any foods that have a lot of fluids in them. So if you were to eat a popsicle, that's a liquid. If you were to have watermelon, that's a lot of water in there. So that is considered as part of the 32 ounces of fluid. So when people who are on dialysis and they go to dialysis, they weigh them in. When they first get there, they do the dialysis and they weigh them after so they can measure how much fluid has been removed from their system, right? And so this is how they know, like, you've been drinking more than you should have. But with drinking water, this is why I tell people, I can't even give you advice on taking water because I don't know your health. I don't know your kidney function. I don't know what else is going on. So if I tell you drink more water, you'll feel great, and your kidney function is, 25, I might be giving you bad advice. It's water, but it could be bad advice. So this is why this is just educational. I'm not telling you what to do, but in a healthy person, drinking more water is going to help flush toxins out from the kidneys, from the liver, from the colon, from everywhere in the body. But the kidneys love water when they're healthy. So the other thing you can do to protect your kidneys is stop smoking. Find a program, find some help to stop smoking, and stop being around people that smoke. That secondhand smoke is just as bad as if you were smoking it. So be careful, be mindful about where you're at. The other thing is to reduce toxic chemical exposures. Your kidneys can be highly affected by toxins because the kidney's job is to filter and remove toxins, right, from the body. So if you are overexposing yourself to chemical toxins in the environment, And I did an episode on that previously, so you might want to go back and check that. These toxins can create a huge burden on the kidneys. So I want to share some herbs. Once again, I'm not telling you to go get these herbs. There's a lot of them actually that help the kidneys. But these are some that are, gentle and safe. But you want to know where you're at health-wise overall. One of them is called Urtica dioica. It's also known as stinging nettles. So this helps the clearance of waste. It also provides a soothing effect to the urinary tract system. And the seed of stinging nettles is known to be nephro-restorative. So nephro is for the nephrons related to the kidney, and protective means it's protecting those. It's a nephro-protective herb. And so this can help people who have type 2 diabetes to protect their kidneys, and of course other medical conditions that are affected, like lupus, for example. People with lupus can develop lupus nephritis, which is inflammation of the kidneys. So this is a very gentle herb that you can find over the counter as a tea. There's other stronger, in a capsule or in a tincture, which is an herbal extraction that's just more concentrated. Glycyrrhiza, this is one of my favorites. The glycyrrhiza is an herb that you can use in many ways, but I specifically use it for people who are on dialysis, or they're not on dialysis, but they have high levels of potassium. And even with eliminating those from their diet, they're not able to get them lowered. I've had patients who are on dialysis. Their doctors put them on a binder to reduce potassium, but it's still high. So I'll throw glycyrrhiza as a tincture, and it helps bring those potassium levels lovely. And so some of the doctors and the nutritionists at the dialysis center that I would communicate with, they're like, can you put them on that stuff that you put them on that helps? Like, yeah, glycyrrhiza is the herb. Like I say, it helps to bind potassium levels and get it out of the body. Milk thistle is another great herb. Now, milk thistle is known to be liver protective, but when God created plants, he didn't just give them one assignment. He gave them multiple functions. And so one of the functions of milk thistle, in addition to helping the liver, it also helps the kidneys. And this has a nephro-restorative effect on the kidney. So that means it helps them to restore. And so it's gentle to use, it protects the kidneys, and it decreases damage to the nephrons, specifically in the kidneys. And so a lot of this, it's all going to depend on dosing based on the individual person. That's why you should really work with someone who's trained in using botanical herbs. You reading it from the internet, or some coach having learned this from the internet, or a quick weekend course on botanicals is not sufficient. When we studied botanical medicines, we studied all the pharmacology, all the effects with other pharmaceutical medications and different conditions, and how to dose for different people in different conditions. So it's a lot more extensive than people realize when we're using these natural substances. Astragalus is another herb that will help reduce inflammation and help in people with renal failure, autoimmune conditions, anything that's affected like that to the kidneys. So astragalus, it's a great herb to use. Hey, look, we have talked about a lot of things in this episode as it relates to the kidneys. And the main takeaway that I want you to know is that do the prevention side. If you start with the diet, that's huge, and if you won't need to take any herbs, be aware of what your EGFR numbers are and start being proactive to taking care of your kidneys by eliminating toxins and eating healthier options for foods. So I hope you found this, episode, very informative. I want to help as many people be educated on kidney health and ways that they can, improve their kidney function. Because I don't want to see people going to dialysis. It's a lot on you, and it's a lot for your family to also experience and see through. So we're going to transition now to the good, the bad, and the ugly of the medical healthcare system. So one of the things that I have noticed in conversations with nephrologists is that they only monitor kidney function. They're not there to tell you how to improve your kidney health. And if you are interested in avoiding having to end up on dialysis or a kidney transplant, you want to make sure that you follow the recommendations on this, but also talk to your doctor about it or find someone that can help you with that. Unfortunately, monitoring the person till it's time for dialysis, that's not really a solution. It's just waiting for you to need to be on dialysis. And like I said, from my experience, it's not something that you want to be doing till, the end of your days. Now, it's good that that's an option, because it does extend people's life, but that's just not the way to go. So I hope you found this information in today's podcast useful. Please share it with someone who does have kidney disease or wants to prevent kidney disease. And make sure to like and subscribe to the channel. Until next time, guys, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.